Avoid turmeric if you suffer from these three health conditions. While turmeric is often praised for its incredible health benefits, it's not a one-size-fits-all remedy. For some people, this so-called superfood may actually do more harm than good. Are you surprised? Well, you're definitely not alone. Turmeric might be good for boosting immunity or reducing inflammation, but it's not always safe, especially if you're dealing with certain health conditions. In this video, I'll take you through 3 specific health issues where you should absolutely avoid turmeric. And don't go anywhere after understanding these risks. Stick around to learn about 5 amazing benefits of turmeric that may transform your health when used correctly. Now let's get started. Alright, let's talk about your gallbladder. This small organ plays a crucial role in digestion by storing and releasing bile, a fluid produced by your liver to help break down fats. Now, if you have gallstones, those pebble-like deposits that can form in your gallbladder, or if you're prone to gallbladder issues, turmeric is something you'll want to steer clear of. Here's why. Turmeric contains a compound called curcumin, which gives it that vibrant yellow color and is responsible for many of its purported health benefits. However, curcumin also happens to stimulate the liver to produce more bile. And while that might sound like a good thing, for someone with gallstones or a history of gallbladder problems, this increased bile production can spell trouble. Imagine this: your gallbladder is already struggling, and then you introduce something that makes it work overtime. This can lead to a buildup of pressure in the gallbladder, triggering a cascade of unpleasant symptoms like intense pain in your upper abdomen, often radiating to your back or right shoulder blade. You might experience nausea, vomiting, indigestion, and bloating. Not exactly the kind of experience you want to sign up for, right? Now, to make matters even more complicated, turmeric also contains oxalates. These naturally occurring compounds are found in many plant-based foods, but they can be problematic for people prone to gallstones. Oxalates can bind with calcium in your bile, contributing to the formation of calcium oxalate stones, the most common type of gallstone. So, if you already have gallstones or are at risk of developing them, consuming turmeric might inadvertently fuel their growth or trigger a painful gallbladder attack. Trust me, you don't want to experience the excruciating pain of a gallbladder attack. It can land you in the emergency room, potentially needing surgery. Remember, prevention is key, and being mindful of your diet is a crucial part of managing gallbladder health. If you're concerned about your gallbladder or have a history of gallstones, talk to your doctor. They can provide personalized advice and help you make informed choices about your diet and lifestyle. Now, you might be thinking, okay, but what if I just use a little bit of turmeric? Surely a pinch here and there won't hurt, right? Unfortunately, it's not that simple. The amount of turmeric that can trigger gallbladder problems varies from person to person. Some people might be more sensitive to its effects than others, so even a small amount might be enough to set off a reaction. The bottom line is this: if you have any concerns about turmeric and its potential impact on your gallbladder health, it's always best to err on the side of caution. Talk to your doctor, get their expert opinion, and make informed decisions that prioritize your well-being. Let's talk about iron deficiency and anemia, 2 conditions that affect millions of people worldwide. Iron is crucial for our bodies to function correctly. It plays a vital role in creating red blood cells, which carry oxygen throughout our body, giving us energy and keeping us going. When we don't have enough iron, our bodies can't produce enough healthy red blood cells, leading to iron deficiency anemia. This can leave you feeling tired, weak, and short of breath. You might experience pale skin, dizziness, headaches, and even cold hands and feet. Now, here's where turmeric comes into play. While it boasts numerous health benefits, turmeric can interfere with iron absorption, potentially exacerbating iron deficiency anemia. One of the main culprits is curcumin, the active compound in turmeric we discussed earlier. Curcumin has a pesky habit of binding to iron in your digestive system. Imagine curcumin like a tiny magnet, latching onto iron molecules in your gut. While this binding action might sound harmless, it creates a roadblock for iron absorption. When curcumin binds to iron, it makes it difficult for your body to absorb this essential mineral. As a result, your body misses out on the iron it desperately needs, potentially worsening your anemia. But wait, there's more. Turmeric also contains polyphenols, which, while beneficial in some ways, can also hinder iron absorption. These polyphenols can bind to iron, similar to curcumin, further reducing the amount your body can take in. It's like having a double whammy against iron absorption. And if that wasn't enough, curcumin can also alter the balance of bacteria in your gut. While some changes in gut bacteria can be beneficial, In this case, it can further complicate iron absorption. You see, some types of gut bacteria actually help our bodies absorb iron more efficiently. However, curcumin can disrupt this delicate balance, potentially reducing the population of these helpful bacteria. This disruption can make it even harder for your body to get the iron it needs. So, if you're struggling with iron deficiency or anemia, it's crucial to be mindful of your turmeric intake. While it might offer other health benefits, its potential to interfere with iron absorption could worsen your condition. Now, I know what you're thinking. Does this mean I can never enjoy turmeric if I have iron deficiency? Not necessarily. It's all about moderation and timing. If you love turmeric and can't imagine giving it up entirely, try consuming it separately from iron-rich foods or iron supplements. This way, you can minimize the chances of curcumin interfering with iron absorption. For instance, enjoy your turmeric latte in the morning and have your iron-rich spinach salad for lunch. Or if you're taking an iron supplement, take it a few hours apart from consuming turmeric. And as always, communication is key. Talk to your doctor or a registered dietitian. They can provide personalized advice based on your individual health needs and help you make informed choices about incorporating turmeric into your diet safely and effectively. Chapter 3. Kidney stones. Let's delve into the fascinating world of our kidneys, the body's natural filtration system, working tirelessly to remove waste products and excess fluids from our bloodstream. These bean-shaped organs play a vital role in maintaining our overall health. However, our kidneys can sometimes face challenges, and one such challenge is the formation of kidney stones. These pesky little crystals can form in the kidneys, causing excruciating pain and discomfort. Now, where does turmeric fit into all of this? While turmeric is often hailed for its health benefits, it's essential to be aware that it can contribute to kidney stone formation in certain individuals. Remember those oxalates we talked about earlier? Well, they're back. And this time, they're teaming up with calcium in your kidneys. You see, when oxalates bind with calcium, they can form calcium oxalate crystals, the most common type of kidney stone. Turmeric, unfortunately, contains oxalates. So if you're prone to kidney stones or have a history of this condition, consuming turmeric regularly, especially in large amounts, can increase the oxalate load on your kidneys. This increased load can tip the scales in favor of stone formation, leading to those dreaded kidney stones. But wait, there's more to the story. Turmeric also has diuretic properties. Now, diuretics in general aren't necessarily a bad thing. They help flush out excess fluids from our bodies, which can be beneficial for some people. However, for those prone to kidney stones, turmeric's diuretic effect can be a double-edged sword. While it might seem counterintuitive, dehydration is a key risk factor for kidney stone formation. When we're dehydrated, our urine becomes more concentrated, allowing those oxalates and calcium to cozy up closer together, increasing the likelihood of crystal formation. So, turmeric's diuretic properties, while seemingly harmless, can contribute to dehydration, especially if you're not counteracting it by drinking enough fluids. Now, I know what you might be thinking. Does this mean I need to banish turmeric from my life completely if I'm prone to kidney stones? Not necessarily. As with many things in health and nutrition, it's all about moderation and balance. If you enjoy turmeric and want to include it in your diet, do so in moderation. Don't go overboard with turmeric lattes, supplements, or heavily spiced curries every day. Instead, savor it occasionally as part of a balanced and varied diet. And remember the golden rule. Stay hydrated. Drinking plenty of fluids throughout the day is crucial, especially if you're consuming turmeric. Water is your best bet, but you can also opt for other hydrating beverages like herbal teas or diluted fruit juices. Most importantly, talk to your doctor or a registered dietitian. They can assess your individual risk factors for kidney stones, provide personalized advice, and help you make informed choices about incorporating turmeric into your diet safely and healthily. Turmeric. Enjoy it wisely. I know turmeric is often seen as a magic ingredient, but like anything else, it's not for everyone. If you or someone you know is dealing with gallstones, anemia, or any of the other conditions we discussed, it's important to think twice before adding turmeric to your routine. Remember, I'm not here to scare you off turmeric completely. It can be amazing when used appropriately. But your health always comes first, so make sure you're making choices that work for you. And of course, always talk to your doctor or healthcare provider before making any big changes to your diet or supplements, especially if you're managing a health condition. Now that we have discussed the many health conditions that may require you to avoid turmeric, let's talk about some other topics of interest. Interested in knowing more about health secrets? Watch 9 superfoods to naturally boost your immune system and never get sick. You may also try our video on 11 collagen-rich foods to boost youthful skin. Go ahead, click one, or better yet, watch both and learn more about your body. How do you consume turmeric? Let us know in the comments below.